Complications to medical treatment. The complications to medical treatment can occasionally lead to the development or exacerbation of tinnitus, a condition characterized by the perception of sound in the absence of an external stimulus. While tinnitus is more commonly associated with underlying auditory disorders or neurological conditions, certain medications, procedures, or interventions used in medical treatment may contribute to tinnitus as a side effect or complication. Understanding the potential mechanisms and risk factors for medication-induced or procedure-related tinnitus is crucial for healthcare providers to recognize and manage this complication effectively. Medication-induced tinnitus. Some medications have been associated with tinnitus as a potential side effect. These medications may affect the auditory system directly or indirectly through various mechanisms, leading to changes in neural activity and tinnitus perception. Common classes of medications implicated in medication-induced tinnitus include nonsteroidal anti-inflammatory drugs (NSAIDs), such as aspirin, ibuprofen, and naproxen, particularly when used at high doses or for prolonged periods. Certain antibiotics, including aminoglycosides, e.g. gentamicin, macrolides, e.g. erythromycin, and quinolones, e.g. ciprofloxacin. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, or tricyclic antidepressants, TCAs, which may alter neurotransmitter levels and affect central auditory processing. Loop diuretics, e.g. furosemide, and other medications that can cause electrolyte imbalances or ototoxicity. The development of medication-induced tinnitus may be dose-dependent, reversible upon discontinuation of the offending medication, or persistent in some cases. Ototoxicity. Ototoxicity refers to the toxic effects of certain medications or chemicals on the auditory system, including the cochlea, auditory nerve, and central auditory pathways. Ototoxic medications may damage the hair cells in the cochlea, disrupt the function of the auditory nerve, or interfere with neurotransmitter release within the auditory pathways, leading to tinnitus, hearing loss, or balance disturbances. Common ototoxic medications include aminoglycoside antibiotics, certain chemotherapeutic agents e.g. cisplatin, loop diuretics, and high-dose aspirin. Procedural complications. Certain medical procedures or interventions may also lead to tinnitus as a complication, particularly if they involve manipulation of the auditory system or adjacent structures. Examples of procedures associated with procedural tinnitus include middle ear surgery or tympanoplasty, which may damage the delicate structures of the middle ear or cochlea and alter auditory function. Dental procedures involving dental drilling, which may generate high-intensity noise or vibration that can affect auditory function temporarily. Cardiovascular procedures, such as cardiac catheterization or angioplasty, which may involve exposure to contrast agents or hemodynamic changes that can affect blood flow to the inner ear. Individual risk factors. Individual susceptibility to medication-induced or procedure-related tinnitus may vary based on factors such as age, underlying health conditions, genetic predisposition, previous exposure to ototoxic agents, and overall auditory health. Patients with pre-existing hearing loss, vestibular dysfunction, or a history of tinnitus may be at increased risk of developing medication-induced or procedure-related tinnitus. Management and prevention. Management of medication-induced or procedure-related tinnitus involves identifying and discontinuing the offending medication or addressing underlying procedural complications promptly. Healthcare providers should carefully evaluate the risk-benefit ratio of medications or interventions that may pose a risk of ototoxicity or tinnitus and consider alternative treatment options when appropriate. Patient education regarding potential side effects, early recognition of tinnitus symptoms, and regular monitoring of auditory function are essential for minimizing the risk of medication-induced or procedure-related tinnitus and optimizing patient safety and outcomes. In summary, complications to medical treatment, including medication-induced ototoxicity and procedural complications, can occasionally lead to the development or exacerbation of tinnitus. Healthcare providers should be vigilant in assessing and managing potential risk factors for medication-induced or procedure-related tinnitus, including careful selection of medications, monitoring for early signs of ototoxicity, and prompt intervention if complications arise. By recognizing and addressing medication-induced or procedure-related tinnitus promptly, healthcare providers can minimize harm and improve patient outcomes in clinical practice.